Assalamu alaikum wa rahmatullahi wa barakatuhu. Good afternoon, everyone. And you're listening to Rated on 107.6 FM live transmission. I'm your host, MASHAL Tariq, yet with another episode of Mindful Moments from 3 to 4 p.m. is like you know that have a weekly show with you all from 3 to 4 p.m. Right now in our dials, the time is 3:03. Before I let you know and start with an introduction of who our guests are today, you can see from my post if whoever is watching live on our YouTube channel today, we welcome you all to Mindful Moments program, where we explore important topics with thoughtful approach. And today we are addressing a vital health issue, glaucoma. So, the glaucoma is becoming a very vital issue for the health of people and known as the silent thief of sight. Glaucoma can gradually take away wisdom. Sorry, yeah. Today we are discussing on a vital health issue, which is a glaucoma known as the silent thief of sight. And glaucoma, as you all know, can gradually take away vision without any warning. This condition affects millions worldwide, and managing it properly is crucial, especially during Ramadan, because there is a challenge with this medicine of glaucoma during Ramadan, and fasting can present unique challenges for those dealing with glaucoma, particularly when it comes to medication schedules. In today's episodes, I have invited some guests from NHS. It's Danish Ashraf and Robin Asprey. And in today's episode, we will explore what glaucoma is and who is at most at risk with this disease and how it is treated and how patients can manage the treatment during fasting. So that's an important thing, issue which we have to address today. And so stay tuned and keep listening for essential conversation that could make all the difference for you, someone who care about it. And to address this issue, I would just like a small intro before I invite my guest on air, and they are already here on the link. Hi, good afternoon, and a warm welcome to our show. And I was just trying to connect, and people, audience who is listening to us, and the listeners must be wondering where is the interruption going on. Well, just trying to connect and the link and on the YouTube channel so you can see us and see this session, an important session which we are going to address today on our YouTube channel as well. So, just before I introduce my guest again, I would like to mention here something about like many Muslims living with glaucoma stop using their prescribed eye drops during Ramadan, fearing it may invalidate their fast. So, research shows that nearly half, 45.5% of patients, share this concern as excess drops can drain through the tear ducts into the back of the throat and sometimes leaving a noticeable taste. And however, leading Muslim scholars from all Islamic schools of thought confirm that eye drops are permissible while fasting, even if some taste reaches the throat. So, address this concern, we have invited today our Danish Ashraf, uh, an optometrist based in Glasgow, representing the British Islamic Medical Association, BIME, and Robin Asprey, Development Manager Outreach Services from the Support Services team at Glaucoma UK. They will discuss how patients can effectively manage their eye health during Ramadan while maintaining their fast. So let's welcome them on our show. Good afternoon, Danish and Robin. How are you doing? Can you hear me? Just to make sure our connections and we don't have any technical issue with the sound here.
Good afternoon. Assalamu alaikum.
Good afternoon. I can hear Danish. What about Robin? Uh, I'm having an issue with your sound, Robin.
Can you hear me now?
Yes, I can hear you now. It's perfect.
Wonderful.
Everything
Thank
is
you.
perfect. Wonderful. So, first of all, welcome to our show and thank you for taking out time for us. You know that we are on Radio Dawn 107.6 F live transmission, and the show is Mindful Moments with MASHAL. So, welcome once again and good afternoon. So, you know that we are addressing a very sensitive topic today, and it's glaucoma and the medication and how to deal with it in Ramadan. So, I'm sure that our listeners must be very interested in this. So, first of all, let's start with it. What is glaucoma and how and who is most likely to be affected by it? So first, let's the people who are not aware of it or the listeners have a very nominal knowledge about it. Let's start with what is glaucoma and who is most likely to be affected. So
Afternoon, Michelle. Thanks for having us on air to discuss this important topic. So, glaucoma is a group of conditions that causes a progressive and irreversible loss of sight. So, as you're sitting in your room just now, if you look straight ahead and if you put your arms out, the extent of the vision that you can see, that is your full range as it goes back the way. Now, glaucoma causes that reduction all the way down until you're only left with a small island of vision in front of you, tunnel vision. So if left untreated, you would only be left with tunnel vision. And obviously that would cause you to not be able to drive, cross a road safely, or do your day-to-day tasks. So that's the condition that we're talking about today.
all right, okay. And as you know that glaucoma is treated, and when options are available for the patients, there is a medication for it, but it's still a silent, as we have said mentioned, thief for vision loss. So how that could be treated, or how can we save people from
Yeah.
losing their sights?
So firstly, the first piece of advice would be whether you think your vision is good or not good, we would encourage everyone to get regular eye tests.
Mm-hmm.
Um, Glaucoma, as you say, there are no symptoms,
Mm-hmm.
pain, redness, anything in the eyes
Mm-hmm.
that a patient would pick up on their own. It would need to be the optometrist, such as myself, or coming to the opticians to come and
Mm-hmm.
do your eye test. And for the patients that have been to the opticians for eye tests already, the test where you click the button when you see the flashing dot, that's one of the tests for glaucoma. There's
Mm-hmm.
no single test for glaucoma, but that's
Okay.
one of the tests. And so your question was about, sorry, I've lost the thread. What was the main question you asked? Sorry? The treatment options?
Yes, because the treatment option, yes, of course, definitely.
Yeah.
What options are available to the patients for the treatment of this?
So the main issue with glaucoma normally is that the pressure in the eyeball is too high.
Mm-hmm.
So the treatment is to reduce that pressure. So
Okay.
there's three sort of main options.
Mm-hmm.
Your first option, the one that we're discussing today, is eye drops, and that reduces the pressure in the eyeball and relieves some of the strain on the eyeball, which causes the loss of sight. Another
Mm-hmm.
option, which the eye doctors, the ophthalmologists at the hospital can use, is a laser to burn some holes on the front of the colored part of the eye, which
Okay.
reduces some of the pressure. And your third
Okay.
option is a surgical option, which is to put a drainage system in.
All right. And is it quite serious, the surgery part which you were mentioning just now?
Uh,
Or is it
it's
it's just a minor surgery and it's fine?
it's the surgery you would only need if the drops and the other things weren't working for you normally. The more
Oh,
advanced treatments are the laser. Now,
okay.
most people get that, but for some patients that doesn't work, so they have to do something further. And at the end of the day, Michelle, the other option is
Mm-hmm.
your loss of sight. So it's a small price to pay.
Yeah. It's quite sensitive, and it's something which we do neglect sometimes. The people could neglect, and I just want to welcome and good afternoon to Robin. Also, so you've been quite here. So I have a question for Robin. Can anyone develop glaucoma, or are there high risk groups, or it's just anyone can develop it?
Yeah, absolutely. So the answer really is both. Yes, anybody can develop it. There are childhood glaucomas. Some people are born with glaucoma, but
Okay.
yes, there are people who are more likely to develop glaucoma than others. So as people get older, people are more likely to develop glaucoma. Unfortunately, it's one of those things we hear a lot, isn't it? That chances of developing lots of different health conditions is more likely as we get older, and glaucoma is very much one of those things.
Mm,
So yes, as we get older, we are more likely to develop it. There are other risk factors as well. So ethnicity can be a risk factor. If people are of African Caribbean background or East Asian background,
mhm,
that can increase the chances or the likelihood of people developing glaucoma as well.
mhm,
And there's lots of research being done now into genetics and glaucoma as well, because we know that glaucoma runs in families. We know that there are more than 100 different genes now that have been identified that might be contributing to glaucoma being passed down from parents to children. So, we've spoken a little bit about eye tests, but it's really, really important, because anybody can develop glaucoma, that you
mhm.
do go and get your eyes tested every 2 years. But it's
Okay.
even more important as you get older, if you're of
Mhm,
African Caribbean or East Asian background, and if you
mhm.
have a first degree relative, so that's a parent or a sibling with glaucoma, then the chances are significantly increased. So it's
All
even
right.
more important.
So it's mainly the hereditary disease, sometimes mainly. And what when you're talking about the aging, so what age factor we are looking towards this glaucoma developing?
Yeah, so the older we get, the more likely it is to develop. So, if you have a family history of glaucoma, we will in England give free eye tests to people over the age of 40 to be
All
checking,
right.
because over 40, the chances are increasing. But if
Mhm,
we're looking at the general population, and when the chances start increasing more significantly, kind of
mhm.
between 60 and 80, it increases really significantly. So it's one of those things. It is a progressive eye condition, and in its
Right.
early stages, that progress tends to be quite slow. So going for an eye test once every 2 years is absolutely fine. If
Mhm,
you have glaucoma, though,
mhm,
and it needs to be being treated. Obviously, we're here talking about eye drops today. If you
mhm.
stop that treatment, then things
Okay.
can progress much more quickly, because
All right.
as progression goes on, it can increase in speed.
All right. Well, thank you, Robin, for explaining it so clearly to us, the risk factors which play a huge role in development of glaucoma and the age from where we should start taking precautions and preventions. And of course, the tests are important. My next question to Danish is about how these issues that many face during Ramadan. There is the misconcept about the medicines during Ramadan and fasting. So, what does glaucoma have to do with fasting during Ramadan, Danish?
Yeah,
Are
so
you?
the issue that we have during Ramadan,
Mm-hmm.
can you hear me okay?
No, I'm sorry. Your sound is a bit feeble, Danish. Robin's was better. The mic,
Let me just
maybe.
check here.
Let me just check here as well.
Okay. If that's better for you.
Yeah, it's fine. It's perfectly fine.
So the issue that we have during Ramadan is
Mm-hmm.
that obviously during the daylight hours, Muslims will stop eating and drinking during the month of Ramadan. Um, However, Muslims being quite meticulous about their fasting,
Mm-hmm.
they maybe think that, well, my eye drops, I can taste it. I can taste it in my throat, so I'm not going to
Yeah.
take the eye drops. So
Mm-hmm.
what we're trying to push out to people and educate people is actually the majority opinion. even in Islamic scholars, is that it doesn't break the fast.
Okay.
And if you're concerned about that, then we would encourage you to still use the eye drops
Mm-hmm.
after the fast is opened or before it begins. And the reason for that, Mashal, is that,
Mm-hmm.
like we said before, glaucoma, it doesn't go back. So if you stop for Ramadan, or if
Mm-hmm.
you only use it part of the way in Ramadan, you
Mm-hmm.
will lose some of your sight, which will not come back.
Okay.
So this is very important that patients don't stop this treatment.
All right. All
They must
right.
keep up the treatment.
So to the all my listeners who are listening and going to fast in Ramadan, so the medicine is very important and it doesn't affect your fast. That's the important message what we are relaying here, right? With this conversation. So what happens if uh, like for some people they are not able to take their medication or eye drops on time, or they realize about this treatment. So what are the potential dangers they encounter?
So if we're not treating glaucoma,
Yeah.
what we said at the start of the conversation, if we don't treat it, the
Mhm.
vision comes like this, and it closes, and it's like you're looking through a small tunnel. So
Okay.
that's the advanced stage of glaucoma. That won't happen overnight, but the
Uh-huh.
progress of that, we're trying to stop it. So
Oh,
that's it's blindness and loss of sight is what we're trying to advise you to avoid by
complete
using the drops.
blindness. Yeah, yeah.
So
Oh,
we would not lose completely the small vision in the middle. You would remain with the glaucoma, but you would be registered blind or partially sighted
mhm.
if left untreated. And we would not recommend any stage that you pause that treatment, even in Ramadan.
Oh, okay. So, what are the like dangers? As I mentioned, that if the more further dangers, if like if they once they are partially, as you mentioned, if they're considered partially blind and they lose their sight, so there is no other remedy or surgery they can get regain it back or something. Is some is that severe level of the losing the sight? It is.
Yeah, so there's two main things with sight. Number one is light. For example, we wear glasses. And that makes the
Mhm.
vision, the map of our sight, it makes that clearer. With glaucoma, what we're talking about is not the clarity. What we're talking
Mhm.
about is actually part of the vision reduces and it goes away. So your glasses would help you with what's left and make that clearer. They won't give you back the sight that's been gone.
Okay.
So again, using the analogy of looking through the tunnel, if you can
Mhm.
only see this small circle in the middle of your vision, you can
Mhm.
read a word or two at a time, but you
Mhm.
can't drive and you can't cross a road unless you're with someone. So there isn't any way of reversing this, as you say, and that's the issue with glaucoma. It's silent and it's progressive, so it
Mhm.
doesn't go back the way. We don't have any. We can only slow it down.
Yeah, it's quite sad, and but then people have to live with that. So, what can patients do if they are uncomfortable using eye drops? This is I'm coming to the question with the Ramadan during the hours. It's with you, Robin. If you could answer that, what can patients do if they are uncomfortable using eye drops during Ramadan? Like what they can do more better. Like there
Yeah,
are some patients they will have their own uh, concepts and their own thinking about it.
absolutely. And, we absolutely appreciate that everybody will have their own thoughts and feelings
Mm.
about using drops during Ramadan. And
Yeah.
we're not here to kind of make anybody feel uncomfortable. We're just here to share the message about the importance of using them. So, as Danish has already kind of said, one of the things that people can do is continue to use their drops every day, but do that outside of fasting hours, which will allow people to still keep up their drop regime and
Mhm.
make sure that they're keeping the pressures lowered. If people feel okay about taking drops during Ramadan and during fasting hours, they can reduce the amount of drops that go through the tear
Oh.
duct and down into the throat by doing something called punctal occlusion.
Mhm.
And that's where, if you put the drop into your eye, After you've put the drop in, you gently close your eye, you use your finger and you push in the corner of your eye towards the bridge of your nose.
Mm-hmm.
And that just gently pushes shut the tear duct. It closes it whilst you're pushing it. So if you hold that for 1 to 2 minutes, that
Mm-hmm.
should allow the eye drop to be absorbed into the eye without it draining through the tear duct and down into the throat. So that's an option as well that people can do if they're wanting to reduce the amount that might go down the back of their throat. Interesting, as a charity, we suggest everybody does that anyway when they're putting their drops in, because we want the eye drops to stay in your eye. We don't want them draining into your stomach. They're
Right.
designed to work locally. But we
Mm-hmm.
also would encourage everybody, speak to your community, speak to people at the mosque. As we've said
Mm-hmm.
already, the majority of Islamic scholars are saying they completely agree that taking eye drops doesn't invalidate anybody's fast, and therefore please do continue to use your eye drops as usual, but have those conversations and come to something that allows you to both fast
Mm-hmm.
in the way that you would like to fast and maintain the health of your eye.
Thank you. Yes, that's a very important message which you have given, Robin, to our listeners, because making an awareness everywhere in the community and in the mosque and all, which the message which you have done is very important, because in fact, after all, it's saving the lives and their eyesight. So it's a matter of their eyesight and living a healthy life. So it's a very important message, and we should spread it out in a proper manner. And thank you for being here, for spreading it out for us also, and making it so much clear for people who have some myths and misconcept about it. So, one more question, like Robin, with you: where can listeners go for more advice or support? And if they suspect they have a glaucoma or need help managing the condition during fasting, where they can approach more NHS or doctors or farm?
Absolutely. Yeah. So, obviously, if you going to your high street optometrist and getting your eyes checked is a great place to start. If you have
Mhm.
glaucoma or want more information generally about glaucoma, we have a website at www.glaucoma.uk, and on our website we also have a page specifically dedicated to Ramadan, which is glaucoma.uk/Ramadan. And all of the information that we've chatted about here today is on there,
Mm.
along with lots of other information from the British Islamic Medical Association and the Muslim Council of Britain.
Thank you. That's really good. That's very informative information to all our listeners who are listening to us in the audience. Thank you for your time and everything. Do you have any other message, Danish and Robin, both of you? Do you have any other suggestions or advice to our listeners and the people in community who are listening right now? Because you are on Radio Dawn 107.6 FM live transmission, and you are live on our YouTube channel as well. So which will stay there for people who wants to come back and watch it.
Yeah,
Yeah.
I'll just final message, which is the take-home message to summarize,
Mhm.
which is even in Ramadan,
Mhm.
please don't stop the use of the eye drops,
Okay.
because it will cost you your vision eventually. And if
Mhm.
you have any concerns, speak to your imam. And if there's a position, Islamic position in the fiqh, in the
Mhm.
Islamic law, which allows you to use the eye drops, which the majority is, as Robin said, then please do take that and then continue fasting. But please don't stop the drops. And thank you for having us on, Michelle.
Yeah. Thank you so much for your time, and thank you for being on our show, because I know you people have very busy schedule and you made a time for us, and it's creating awareness and people saving life of the people, and the myths, clearing the myths and concepts which people have for fasting. So thank you so much for your time, and you both have a nice day. Thank you, Robin, and thank you, Danish, for your time.
Thank, thank you, Michelle. Collapse.
Thanks
Thank
for
you.
having us.
Thank you, Robin. And you
Bye.
all both have a good night. Have a nice day. Thank you.
And you.
Take care. Allah Hafiz. So, We'll proceed on our commercial break within a minute. And people, you're listening to Radio Dawn 107.6 FM live transmission. I'll be right back after a commercial break and Asr Azan with you.